Dr. Lund, how does a woman know if she needs a breast lift?
It's a real challenging question because a lot of patients come in expecting that they're just going to have an augment put in, an implant put in, and the breast will rise somehow. There's an easy test you can do. It's based on Ann Landers. Many years ago, somebody had written to her asking her about how do they know that they need to wear a bra, and they said, well, do the pencil test. What you do is you lift up your breast, and you put a pencil underneath your breast, then you let go of your breast, and if the pencil stays, according to the advice columnist, you needed to wear a bra. Well, now you know where that pencil's at. If you're staying at home or looking in the mirror, figure out where the pencil is. And if your nipple is sitting at or below where the tip of your finger is when you reach up underneath your breast, odds are you're going to need some kind of lift to recenter that nipple back up onto the breast mount, because the implant can't go really any further down than where the end of your finger is, and the nipple will be hanging off the end of it. That's not a very attractive breast. So in those patients, in order to get the best aesthetic result, they may need to lift the nipple.
So if a patient can put a whole box of pencils underneath there, you think that which type of lift would she need?
Well, it varies. You know, the one thing about breast lifts is that there are so many different variety of types of breast lift procedures, and it's not that we don't have a technique that works well for patients, but you have to remember, women's breasts sink and sag in a really infinite variety of ways. And so if you're comparing Mrs. Smith and Mrs. Jones and the way their breasts have sagged, they may both have sagging breasts, but they may be maybe about the same weight and wear the same bra size, but the breasts are totally radically different in their way they've sagged, and the techniques we're going to have to use are going to be different. So there is no one particular procedure that you can say, this is the only procedure I do for a lift.
So what type of incisions are there?
They range from just a little incision right up above the nipple. That's just going to bring the nipple up a little bit. They range from incisions that go around the nipple that are going to lift the nipple and tighten up some of the tissue around it, kind of like thinking of a purse string when you pull it tight. There's the incision goes around the nipple and down from the nipple to the chest area. That's often nicknamed a racket incision, lollipop incision, keyhole. You've heard all kinds of different names for it. Our name for it is a vertical incision. That incision always scares women, and rightfully so, because let's face it, there's no line, there's no crease, there's no place to hide that little line. I don't know why, but it's like the most forgiving spot in the body as far as I can tell. You can put a line there and you can come back usually within a year, and it's really difficult to see that line. And then the full mastopexy goes around, down, and has some horizontal part. It looks like either an upside down T, or some people call it an anchor incision. So there's a great variety of incision lengths.
So how do I know which one I would need?
You don't. You're going to have to go in and sit down with your plastic surgeon, and you're going to have to talk with the plastic surgeon. And together, the two of you are going to have to figure out what's the right incision, what type of lift. Because even if let's say your nipple has sunk down at the same level somebody else has, but your skin's got a lot of stretch marks and a lot of laxity to it, and hers is actually in very good condition, you're going to require two different types of procedures to correct that. So it really requires, this is probably one of the procedures in plastic surgery that really requires the most individualization of the procedure to fit the patient.
If a woman prior to having a breast lift is happy with the cup size she's in, let's say she's a nice full C, which is probably mostly skin, and she does the breast lift, will she lose volume? Will she still be in that same cup size after surgery?
Most patients are going to lose some cup size, some volume. When you're thinking about what a lift is, you're going to remove some skin, because by definition, a lift is getting rid of excess skin in the breast. That's what's causing the sagging. When you remove skin, skin's got volume, and so you're going to lose some volume. Now, I can turn around and tell you that there are some patients, though, that you remove the skin and the volume, and you lift, and they actually look bigger than they did when they were hanging and sagging down, because all of it's now pushed up here rather than elongated down here. For them, they actually may not need something else to increase their volume. But for other patients, you're going to possibly have to consider putting an implant in to give back to replace the volume that we've taken out in order to get rid of the excess skin.
So will most women go back to their pre-pregnancy size after a lift?
I don't know. I don't know the answer to that one. That's because most likely not. And the reason why is because most women's breasts don't go back to what they look like. Their bodies don't go back to what they look like after being pregnant. Pregnancy changes lots of things. And the breast tissues are going to change. Particularly the nursed, the tissues internally inside the breast have changed. I like to sometimes point out to patients that if they have areas of change in the outside of the breast, it's like an iceberg. That's the part you see floating above the ocean. The internal changes inside the breast, the part you can't see, are the big part. And some of those are never going to, there's no surgical technique that can reverse back the time to take you back to where you were before you're pregnant. That doesn't mean we can't give it a very attractive and aesthetic result to the breast, but it is unrealistic to expect after having children that you're going to look exactly as you did prior to ever having children. Let's face it, even if you never had children, it'd be unrealistic to expect that at a certain age you're going to look like you did when you were 16, because we can't do that.
So if a patient that has a lift loses that cup size or wants that more volume or fullness on top like she had prior to pregnancy or in her early 20s, how does she get that?
For the most part, we're going to use a breast implant. The breast implant is going to add volume into most commonly this portion of the breast up in here. The bottom of the breast is going to have some of the volume still from what we're lifting. One of the things you can't do, at least under current technology we're not able to do, is we can't take the bottom of the breast and put it up here. There's nothing to anchor it to up here. There's nothing you can put all the sutures in, but over time the sutures will stretch, the tissues will stretch. There's certain area that the breast wants to settle into. So if you're trying to get that volume back, many times you're going to have to use an implant. There's some early study work being done. You're using fat transfers into this area. Highly controversial at this stage. Very early data on it. And really not something that's probably recommended to be done right now in the common everyday plastic surgical practice at this point. Patients need to be cautious, and unfortunately there's some people that are jumping right into it and doing fat transfers, and we just don't have the information yet.
So how long is this procedure? Is it outpatient?
Most commonly, a mastopexy procedure, a breast lift procedure, is an outpatient procedure. And the length of it can vary anywhere from an hour or so all the way up to 2.5 hours in my world, depending upon what I'm doing. Because if I'm doing a lot of lifting and shifting, and if I've got a lot of variables, a lot of changes to the breast, and I'm having to put an implant in, that's going to take me longer. So it varies anywhere from an hour to 2.5 hour procedure, and it is outpatient.
And then what is the recovery time?
Pretty quick. Recovery is pretty quick for these patients. It's not as quick as if you have a breast augmentation procedure, because you're doing more things to the breast. But the patient can still have her surgery on the end of the week, Thursday or Friday, and probably they have a desk job. They're able to go back to their desk job pretty much on Monday or so of the next week. The one thing the patient is delayed on is it may take a little longer to get her back into exercise, or it may take a little longer to be able to go without wearing a bra for a period of time, because the bra is helping support the breast as it heals. We want to take the tension off the areas that we've lifted, and the sutures, they're just threads, and if you put too much tension on things, they will pop or stretch. So we may have the patient wear a bra a little bit longer if she has a lift than if she just had an augmentation.
And what are patients' comments after surgery? What do they notice changes? How does it affect their life?
The vast majority of patients who have a lift are very happy. They really appreciate, because these are patients who appreciate that they're not going to go back to what their breasts looked like before they ever had children. But they're anticipating they're going to have a very aesthetically attractive breast for the woman she is at the time of her life. And that's what a lift is designed to do. So those patients are very happy. There are patients, though, who have unrealistic expectations. that they're going to look like they're 18. And those are the patients that really have, I've learned through experience to spend a lot of time with the patients beforehand, before a breast lift procedure, because as I tell patients, it's really better that we talk about those issues beforehand and decide what can and can't be done and what is going to meet the patient's goals and desires before we do the surgery. And if we all are on the same page, we're going to get a good result.
So we talked about a little bit about recovery, what patients say afterwards. And you mentioned that a lot of patients will need an augmentation with the lift. Can that all be done at the same time? Is that two separate procedures, and what is the recovery for it?
It is not uncommon for a patient to have a mastopexy, a breast lift procedure, and an augmentation at the same time. But there are certain patients that you really can't do it at the same time. And the reason is again, that high variability we've talked about in how much the breast is sagged, how much is it stretched. And for many women, you can do the lift, and you can put in the implant, and you're well within the normal safety margins. But on other patients, you do the lift, and it's such a huge amount that you have to lift. There's so much shifting and moving that is really not a good idea to put an implant in at that time. You risk, if you do so, one, it's very challenging to get the right shape to the breast because you don't know how much shifting and moving is going to occur and re-stretching of the tissues will occur after you lift them. Two, you're putting an implant in, and that implant's going to add weight to already stretched tissues. And three, blood supply. Because if you're doing a lot of these lifting and shifting of tissues, sometimes the blood supply is going to be temporarily diminished to the nipple, let's say, or to around the area of the healing areas. And if you put an implant in, that's going to put pressure on the blood supply. Again, that's something the patient should sit down with their plastic surgeon. And the plastic surgeon will work with her and determine if the lift is going to be appropriate for her to do by itself or to do with an implant. And I know patients want to do it all in one procedure, but we have to remember it's elective procedures, and we want to do it so the patient has minimal risk of complications. And sometimes it's better to do it in 2 stages rather than trying to do it all in 1 stage and get in trouble.